Here's something most people don't know. Chronic Lyme disease can be more debilitating than many cancers. I've seen patients who were bedridden, unable to work, unable to think clearly, trapped in a fog they couldn't describe. Some had neurological symptoms, some had psychiatric symptoms, some were in constant pain. Hi friends, Dr. Fred Bloem here. If you're new to the channel, welcome. I help patients overcome complex chronic illnesses, Lyme disease, mold toxicity, chronic infections, chronic pain, cancer and hormone imbalances using a blend of integrative and regenerative medicine. Today we're talking about Lyme disease and co-infections and why so many people suffer for years without answers. If you've been dismissed, told your labs look normal, or bounced from doctor to doctor, this video is for you. Make sure you're subscribed and sign up for my newsletter so you don't miss upcoming videos. Here's something most people don't know. Chronic Lyme disease can be more debilitating than many cancers. I've seen patients who were bedridden, unable to work, unable to think clearly, trapped in a fog they couldn't describe. Some had neurological symptoms, some had psychiatric symptoms, some were in constant pain. Many told me I lost the person I used to be, and nearly all of them had been told your tests are negative, or maybe it's all stress. Let's talk about what's really going on. Lyme disease is not just Lyme. It's almost always tangled up with mold toxicity, Candida, Bartonella, Babesia, Anaplasma, Epstein-Barr virus, and other viral reactivations. Parasites, immune dysregulation. These layers create a perfect storm. If you treat just Lyme, the patient stays sick. If you treat just Candida, the patient stays sick. If you ignore mold, the patient stays sick. When patients come to me with long-standing fatigue, neuropathy, anxiety, depersonalization, brain fog, autoimmune issues, dizziness, or migrating pain, it's almost never just one thing. This is why I used a layered approach, not a kill the bugs approach. Most Lyme patients go through this experience. A standard Western blot or ELISA test is done. The result is negative. They're told you don't have Lyme. But here's the problem. Standard Lyme tests miss a huge percentage of cases. Why? The criteria are outdated. The wrong antigens are tested. Chronic Lyme often lives in biofilms or stealth forms. The immune system may be too suppressed to make detectable antibodies. Some patients never saw a tick. Most never had a bullseye rash. So I use Vibrant Wellness Tick-Borne Panel, MDL, Medical Diagnostic Laboratories, other specialty laboratory testing, including FISH testing, autonomic response testing, ART, to detect hidden infections, advanced viral mold and toxin panels when necessary, RGCC testing when the cure strain is considered. This is how we find what everyone else has missed. Lyme and its co-infections can mimic multiple sclerosis, ALS-like syndromes, chronic fatigue syndrome, fibromyalgia, autoimmune disease, psychiatric disorders, hormonal disorders, neuropathy, dementia-like states. Many patients describe feeling detached from reality, severe anxiety or panic, OCD-like thoughts, rage episodes, crushing fatigue, migratory pain, brain pressure, temperature swings, POTS-like symptoms, insomnia, trouble thinking or trouble focusing. Bartonella can be especially brutal, with neurological symptoms that can feel overwhelming. You are not imagining it. Your symptoms make sense once the real cause is identified. This is one of the biggest misunderstandings in medicine. Antibiotics can help early Lyme, but chronic Lyme? That's a different animal. Lyme bacteria can hide inside cells, hide inside nerves, shift into cyst forms, create biofilms, go dormant, reactivate, evade immune detection, worsen with the wrong antibiotic sequence, trigger neurological flares. Long-term antibiotics often disrupt the gut, trigger Candida, spin Lyme into deeper hiding, create persister forms, make symptoms worse, suppress the immune system. This is why so many patients relapse or never improve at all. Thankfully, we have better tools now. I follow a clear sequence designed to reduce suffering, calm the immune system, and restore function. This includes biochemical treatments, structural treatments, energetic regulation, immune modulation, and neural therapy, which is one of the most overlooked tools in chronic Lyme care. It's important to fix the terrain first. Before we even touch Lyme directly, I address mold exposure, Candida, gut function, detox pathways, hormone balance, nervous system overload, mitochondrial function, emotional stressors, nutrition. If the terrain is inflamed, acidic, toxic, or overwhelmed, nothing else works. ART, autonomic response testing, helps me determine which layers need attention first. With regard to advanced diagnostics, I use a combination of Vibrant Wellness Tick-Borne Panel, MDL, other specialty laboratory tests, ART, autonomic response testing, viral panels, mold and mycotoxin testing, metals and environmental toxin testing, RGCC analyses when appropriate. We identify all the hidden players, not just one. There are real treatments that create change. This is where my practice stands out because I use treatments most clinics do not offer. Let's talk about ozone therapy. EBU, extracorporeal blood oxygenation and ozonation, and major autohemotherapy, MAH, including the 10-pass ozone treatments, are some of the most powerful tools for chronic infections and immune dysfunction. Benefits include breaking down biofilms, improving oxygenation, reducing inflammatory cytokines, supporting detoxification, improving circulation, and helping the immune system see hidden infections. Patients often feel lighter, clearer, and calmer after EBU sessions and other ozone therapies. Ozonated glycerin and prolozone are great for patients with stubborn joint pain, nerve pain, inflammation, Lyme-related musculoskeletal problems, ligament laxity, trigger points. It helps the immune system address local infections and restores structural integrity. Photodynamic therapy with the Weber needle endolaser is one of my favorite therapies because of its versatility, using blue light with riboflavin, yellow-green for detox, red or infrared with methylene blue, curcumin. We can target biofilms, penetrate tissues antibiotics can't reach, support mitochondrial function, normalize immune activity, improve microcirculation, reduce chronic inflammation. The Weber needle endolaser allows me to deliver these benefits intravenously, interstitially, or locally. The Cura strain, formerly known as SOT or supportive oligonucleotide therapy, is a gene-targeted antisense therapy that uses a small piece of RNA or DNA sequence designed to block the replication of Borrelia, Bartonella, Babesia, Epstein-Barr virus, cytomegalovirus, and other pathogens. It doesn't act like an antibiotic. There's no killing frenzy, no widespread toxicity. It simply blocks the pathogen's ability to replicate so the immune system can regain control. I typically use the Cura strain after mold is addressed, Candida is corrected, co-infections are sequenced, and the terrain is stabilized. This maximizes success and minimizes flaring. Autonomic response testing allows me to tailor treatment order, sensitivity to specific therapies, blockages from scars, dental issues or emotional conflicts, organ stress, meridian imbalances, detox capacity, photosensitizer selection, laser color selection, and timing of the Cura strain. This is what makes the treatment precise, not guesswork. Neural therapy is often the missing link for patients with chronic Lyme, mold issues, and co-infections. Here's why. Lyme doesn't just cause infections. It disrupts the autonomic nervous system, interferes with electrical signaling, and creates so-called interference fields, areas of dysfunctional nerve activity that keep the body stuck in chronic illness. These interference fields can come from old scars, dental work, past injuries, emotional trauma, chronic inflammation, autonomic dysregulation, organ stress, Lyme-induced nerve irritation. Neural therapy uses targeted injections of a local anesthetic, usually procaine, into specific points, scars, ganglia, autonomic hubs, trigger points, or organ projections to reset dysfunctional nerve patterns and restore flow through the autonomic nervous system. Patients often notice calmness, better sleep, less pain, clearer thinking, improved organ function, a shift out of fight or flight, decreased sensitivity to treatments, better tolerance of detox and Cura strain, Emotional releases when necessary. Neural therapy creates a foundation for healing, so the rest of the treatment, EBU, other ozone therapies, cure-restraint, photodynamic therapy, detoxification, works more smoothly and with less reactivity. ART helps me determine which fields are blocked, whether scars or dental areas are interfering, which organs need regulation, whether emotional shocks are held in the system, and how to sequence neural therapy sessions. It's a gentle but powerful intervention that often unlocks rapid progress, especially in patients who have been stuck for years. Patients often ask, how long will it take? It depends on the number of co-infections, mold exposure, mitochondrial function, viral activation, emotional trauma, gut health, immune status, and treatment consistency. Most begin improving within weeks to months, and significant transformation often happens over several months with the right sequence. The goal is not just fewer symptoms. The goal is a body that works again, physically, mentally, emotionally, and spiritually. If you've tried everything but still feel stuck, neural therapy combined with the right biological treatments can open pathways the body has been unable to access for years. Thanks for spending this time with me. If you're struggling with chronic Lyme, mold, or co-infections, and you feel like you've run out of options, you haven't. If this video helped you, please like it, subscribe, and share your experiences in the comments. What symptoms have been the hardest for you? Has anyone ever dismissed your symptoms? Which treatments have helped or made things worse? Your comments help others feel less alone. I'll see you in the next video.